which is a grossly underdeveloped branch in India. One of the reasons is probably because the insurance, there is not enough penetration of insurance companies, insurance within the population, and insurance companies don't pay for these services. So it's something that needs to be done.
Yeah.
Maybe perhaps since we have touched on this topic, we can think of.
नमस्कार दर्शकों, आज हम एक ऐसी बीमारी के बारे में बात कर रहे हैं जो दिन प्रतिदिन बढ़ रही है और जिसका नाम सुनते ही हम डर जाते हैं, और वो बीमारी है कैंसर। इसके बारे में अवेयरनेस होना बहुत ही ज़रूरी है। एंड टुडे वी हैव एन इमेंस प्लेजर टू बी होस्टिंग डॉक्टर संकेत मेहता, who is versatile in this field of oncology. He is the founder director of SSO Cancer Hospital, and he is expert in GI and gynecologist cancer. So let's welcome him to our podcast show चाय पे चर्चा season 4. डॉक्टर संकेत जी, आपका स्वागत है हमारे पॉडकास्ट शो में। And you have been acknowledged and for many things in the field of oncology. लेकिन हम आपके पास से जानना चाहेंगे कि आप एक पायोनियर हो, यू आर एक्नॉलेज फॉर द बीइंग अ पायोनियर इन CRS and HIPEC, and what motivate you for this inventing this new treatments towards oncology, and what was the impact among the patients when they got this treatment?
First of all, thank you for having me today. It is an immense pleasure to be here. When I was in my training in Tata Memorial Hospital, we used to have a lot of patients with advanced cancers. That is because awareness was less. Screening programs are not there in India.
Okay.
जब भी patient diagnose होता था, ज़्यादातर वो advanced stage में होता था. Several patients we would take up for surgery, open the abdomen, find that the disease has progressed, and we would back out without doing anything, which was really disturbing. And at some point, I came to know about this treatment called a Cytoreductive Surgery in HIPEC, which was introduced by Dr. Paul Sugarbaker in the United States. It had been tried by several surgeons in India before me, and majority of the times they had very poor outcomes. Perhaps there was lack of training or lack of facilities, I'm not sure. But somewhere deep down I wanted to do something about it, and that's when I went to France for training. In France, there was another surgeon who was one of the pioneers along with Dr. Paul Sugarbaker. His name was Dr. Francois Quenet.
Okay.
And I trained with him for 1.5 years. Came back to India, started performing these surgeries, and I've been lucky, right place, right time. We had very immediate success. In the first 100 patients, we completed within 3 years.
Okay.
And we had only 4 mortalities, and now that mortality rate has dropped down to less than 1%, which is considered to be the gold standard. We are also doing some of the largest numbers in the world of cytoreductive surgery and HIPEC in India. I've also had the privilege to train several surgeons who are now performing individually in their respective hospitals in different cities across the country, and somewhere there is a deep satisfaction that I have been responsible in a small way to spread this form of treatment which benefits a large number of patients.
So, introducing this treatment, it's not easy. It's always been challenging. And along with the challenges, आपको आपके SSO hospital में branches, centers बनाने में भी आया होगा, because you have planned it from like 6 to 50. Your vision was to expand your center. So, can you tell us what are the challenges you face regarding that?
I think we'll track back a little bit. 10 years back, I was at the start of my career. So actually I started in 2011, but around 2015 I was reasonably successful. I was working in corporate hospitals, but for every patient that you operate in a corporate hospital, you see 5 others who cannot afford. And that is not what you become a doctor for. You want to treat the patients, you know you have the expertise, and perhaps you can do a much better job than others, but the patient cannot afford the treatment. It was, again, deeply disturbing. Something needed to be done about it. Somewhere around that time, me along with my colleague Dr. Jageshwar Pandey, who always used to operate with me, we decided that we'll have our own center. And at that time, the vision was not to have a chain of hospitals. The vision was just to treat patients who can't afford in bigger hospitals. But at the same time, deliver the same quality at a much affordable cost. So we started out in 2021 in the peak of COVID, when we burned through all our life savings just to start our first center, which was just 16 beds. Again, I think it was right place, right time. God was kind. We had immediate success. In 4 months, we were running full. Then we expanded it to 35 beds. Again, that is doing reasonably well. It's running nearly full. Then we expanded to two other locations, Andheri and Thane, and then to Belgaum, and then to Ahmedabad.
Oh my God.
These were opportunities that came along, and we realized that this problem exists everywhere, where cancer treatment is fairly expensive. Surgery, especially, it's a one-time treatment. It is time-bound. It has to be done within a particular stipulated period of time for the patient to
Timeless.
have benefit. And it's a one-time large expense, unlike chemotherapy, where you have several sessions over several months. And if we can cross-subsidize or make it more affordable, obviously for the patients, it's a big benefit. And somewhere in that context, there exists a business model where it addresses both problems. Surgeons who want to do very good quality organ specific surgeries and at the same time serve the people get a platform, and patients benefit because they get affordable surgeries.
As you say, for serving for the people, you have formed the trust regarding them.
Yeah.
So can you tell us about it and what is beneficial for the underserved population and how
Yeah.
they get a benefit? And if our viewer or the person who is watching is listening it out wants to get join to this, to introduce to this, and how the process to that.
Thank you so much for addressing this. So, Cancer Charity Trust was actually established on the behest of my father, Dr. Sanket Mehta, who kind of encouraged me to form this trust because, as I said, at the start of your career, you get more poor patients, and deep down there was this desire to help them. We've been very lucky that right from the word go, there have been people who have come ahead and given donations, helped the trust. A big chunk of our regular donors are actually ex-patients or their families who have been through the battle of cancer, who have realized how difficult it is, and who then come back and in their small or big way help other patients who are suffering from this disease. In the last 5 years alone, we have had donations of more than 5.5 crores, through which we have subsidized treatment of more than 1,500 patients. And this is across various hospitals, not just our SSO cancer centers, but even in Tata Memorial, SRCC Hospital, and various other hospitals where patients get good quality subsidized treatment. There are patients who cannot even pay for the subsidized treatment, and there are several occasions where we sponsor the treatment completely free. And again, I'll take this opportunity on this platform to thank our donors for helping us through this journey.
Amazing.
And if there's anybody who wants to donate, please reach out to us, Cancer Charity Trust. I will drop the coordinates with you.
Yeah, in the description we will be sharing you the details regarding that. And regarding about your expertise, you are like expert in both the terms like GI and gynecologist cancer. So how you approach these treatments towards the patients, what should go for it?
So I think the way we approach a difficult surgery is by having a deep knowledge of the anatomy of the various organs, a knowledge about the physiology and the condition of the patient, and then finally the biology of the disease. Cancer surgery is a very complex topic, unlike other surgeries, where all these three have a deep connection, and every individual patient is completely different from the next one because of the interplay of these three factors.
Okay.
And as a surgeon, you are trained to look at all three and address them with the right proportion of expertise to ensure that there is a good outcome. Now, the only way to progress in this field is to have volumes where you do more and more cases, because there is a average learning curve of between 60 to 100 cases before you become proficient in a particular type of surgery. And if you combine these two specialties, you have at least 15 to 20 different types of common surgeries that you perform.
Oh.
And So you can imagine that the learning curve is more than 1,500 cases, right?
Yeah.
So you need to really work hard to achieve those numbers, and you should have the integrity to introspect and do research, where research makes you ask the hard questions, makes you look at the data that you have and think, how can I improve the results? How can I do it better for the patients? And that ultimately benefits the community at large. It also gives a volume of clinical data that can be used by future generation of surgeons to give better results for them.
So can you elaborate about your role in the Society of Peritoneal Surface Oncology?
Yes, thank you for bringing this up. So, the same surgery that we talked about, cytoreductive surgery and HIPEC, is actually used for the treatment of peritoneal malignancies. And the
Okay.
Society of Peritoneal Surface Oncology is a society we started along with 6 other founders, where we use this as a research platform to spread awareness about peritoneal malignancies and
Wow.
to constantly update the knowledge about the treatment of these malignancies. These includes common cancers like ovarian cancer, colorectal cancer, appendix cancers, and rarer malignancies like peritoneal mesothelioma, pseudomyxoma peritonei, gastric cancers. So these are typically the type of cancers that spread to the peritoneum, which is a membrane
Okay.
that lines the inner side of the abdominal cavity. It is the natural progression of disease of GI and gynec organs within the abdominal cavity, and a lot of patients were traditionally considered to be inoperable once the disease had spread to the peritoneum, or they received substandard treatment when the disease spread there. The society was precisely organized and started to collect data, to do research, and to spread the awareness of the right form of treatment of this disease.
Yeah.
Through the society, we conduct regular annual meetings, we conduct training programs, we have regular webinars on a monthly basis. We have formed a team of surgeons who are deeply interested in doing research in this, called as INDEPSO, which is the Indian Surgeons for Peritoneal Surface Oncology, where we conduct studies. We form consensus guidelines so that we can use that framework to elaborate on what is the right treatment for these diseases, and let's see where it goes.
So we are talking about research, right? So over like 50 international research publications are there. So how you integrate your ongoing clinical test and your medical device R&D to your clinical practice?
So this was actually a part of the problem solving when I started.
Huh.
Regarding medical devices, when I came to India,
Huh.
I wanted to do cytoreductive surgery and HIPEC, but there was no HIPEC machine available. I had taken a very big loan to buy a French brand of HIPEC machine, but then I realized that the capital cost was one time, but the patient had to bear the cost of the consumables, which was prohibitively expensive, and at some point, it was untenable. We could not do a lot of patients. So I reached out to a friend of mine who was a biomedical engineer, and literally, as the story goes, we built the machine in a garage, and then we took it to a workshop, and from the prototype we built a fully functional machine and a assembly line to make the consumables at less than one third the cost of international brands.
Oh, what third?
And then we got the Indian and the CE approvals, which makes us, which assures that there is quality, which can be used for patient treatment across the world. So our machine is certified to be able to be sold across the world.
Okay.
And currently more than 80% of the HIPECs in this country are being done on the machine that we did this R&D, essentially to solve a problem, which was that we wanted to make it cheaper. So that's one journey. Now we are developing 5 or 6 other devices addressing
Amazing.
similar problems, and encouraged by this success that we have had. And regarding research, what we have done is, me along with my colleagues, we have data collection points inbuilt into our clinical systems, into the pattern in which we treat patients. Every record is digitized so that whenever we want to assess a particular parameter, we can go back to the digitized data and retrieve it and do clinical research. We also take part in international studies where, these are multicentric, large trials, sponsored or unsponsored. And we ourselves conduct international studies where international centers participate with us, which is a very big thing considering that we are from India and that we are in private practice. And yet, there are international centers which are willing to participate in studies we have initiated because of the quality of work we are doing. And at some point, deep down, I wish that if I can inspire a few surgeons to follow the same path, I think we will raise the quality
Quality.
or the bar of treatment for our patients in India.
Yes, sure, because you will be the inspiration role model for many of the surgeon, because your is not about treating the people, also about researching, practicing, getting new things, and you are also thinking about how it is, up to the mark for the underserved population and how to get them to this treatment. So all this is the combination package which you have been doing for this in this field. Now, cancer treatment is the thing, one another thing, but second is about how you pull out your patients you have gone emotionally drawn into this incident. So you have something like a small group or a team to support each other, because cancer also need like supporting people, to encourage them, to pull them out. Treatment works excellently, but emotionally also they need supports for this reason.
So I think that is one area where I would say a lot can be done in India. In the Western countries, patient support groups are a big thing, and there is also this whole idea of clinical psychology and psychology of, psychologists addressing patients with deprivement, bereavement, caregiver fatigue, patient fatigue, which is a grossly underdeveloped branch in India. One of the reasons is probably because there is not enough penetration of insurance companies, insurance within the population, and insurance companies don't pay for these services. So it's something that needs to be done.
Yeah.
Maybe perhaps since we have touched on this topic, we can think of something.
Yes. And before going, you would like to tell something to our audience regarding in this, and how to take precautions, or something like which you feel like you need to guide them in this awareness thing.
So, all I can say is that unlike other diseases, cancer does not announce its arrival. Nobody is immune to cancer. In a lifetime, 1 in every 9 people will be affected by this disease. And it's not just one disease, it's a spectrum of thousands of diseases which we pool into one behavior called as cancer. The only way to diagnose this is to have screening programs and to do annual health checkups. Ensure that if there is any symptom that is not improved by treatment for more than 15 days, consult a good doctor and investigate yourself. If there is any strong family history, it is important that you undergo a screening program. There are now these genetic tests which are available, which can tell us with a reasonable amount of accuracy if you are exposed or prone to any type of cancer. And these are very easily available at your doorstep. There is also this whole idea of exposure to harmful chemicals, which includes tobacco, tobacco chewing, smoking, and any form of tobacco is harmful. And unlike what most people think, that it affects only the oral cavity, tobacco causes almost 80 different types of cancers, including upper aerodigestive tract, esophagus, stomach, colorectal cancers, endometrial cancers, breast cancer, liver cancers, etc. So tobacco is something that should be stopped. If you have history of tobacco intake, a regular screening program is important. And there are several other things. One of the other aspects is obesity. Obesity is going to be the second largest cause of cancer in India. primarily because obesity is linked to several cancers like breast cancer, endometrial cancer, colorectal cancer, liver cancers. So, with the explosion of obesity in India and the increased use of processed food, I think
Yeah,
that is
obesity
something.
is always the primary cause of many disease.
Yep.
Yeah, and it is a one of a kind, it should be taken as a disease and you have to, look forward for it.
Absolutely, absolutely.
And many things has been come like GLP injections and
Yeah,
new invention has been coming around for this
yeah.
obesity. That's a different topic right on away. But thank you so much, Dr. Sanket Mehta, for coming to our podcast show. We would like to acknowledge you for this. And this is a small acknowledgement from
Thank
our
you,
side.
thank you so much.
थैंक यू सो मच। एंड दर्शकों, इनके बारे में आपको ज़्यादा जानकारी चाहिए तो डिस्क्रिप्शन में सारे डिटेल्स मिल जाएंगे अबाउट ऑल द थिंग्स विच हैज़ ही हैज स्पोकन अराउंड। एंड अगर आपको हमारा शो कैसा लगा, हमें लाइक करना, शेयर करना, और मिलते हैं हम अगले हफ्ते नेक्स्ट गेस्ट के साथ। बाय, टेक केयर।